Hi, it's Dr. Fox, licensed psychologist in the state of Texas. And in this video, we're going to talk about glucose, mood, and sleep. Glucose, sugar. And I learned something really interesting that I think is really important, particularly for those that are along a personality disorder spectrum. And what we're going to talk about, I think, impacts certainly everybody, but those that are certainly dealing with borderline personality disorder, narcissistic personality disorder, obsessive compulsive personality disorder, all of the personality disorders, but some more than others, like the three that I just mentioned, this is particularly relevant because sleep is so critical. Mood obviously influences behavior. Behaviors tend to lead to a lot of adverse long-term consequences that if you're in treatment or if you've been watching my videos or using my workbooks and books, that you've learned that you have to develop those adaptive strategies. But what if glucose, mood, and sleep can influence that? And I believe that it certainly does. So I've learned some new information and I just want to share it in this short video for you. So what I found is that there's a growing body of evidence that suggests that there's a strong relationship between mood and blood sugar or glycemic highs and lows. Symptoms of poor glycemic regulation have been shown to closely mirror mental health symptoms such as irritability, anxiety, and worry. Now, this should come as no surprise to you, right? As our brain runs primarily on glucose. And high blood sugar levels also make it less comfortable for you to sleep by feeling a sense of like warmness or irritability and unsettledness. And a lot of folks that I've worked with narcissistic personality disorder, children of narcissistic personality disorder, as well as those, of course, with borderline personality disorder, sleep is so critical. I think sometimes we don't realize that the food we eat and the things that we're doing can influence that glucose level that can disrupt our schedule and routine that helps us maintain our mood. And once our mood is stable, it allows us to use more adaptive strategies. What are some things that can influence your level of glucose? These include diet. That's the first one, right? You're not surprised by that. The other one is too little sleep. Can also be too much or too little exercise as well. So you have to find that happy medium of where exercise is beneficial for you. Stress. You're probably not surprised by that. That stress impacts glucose levels, which of course can disrupt your mood and sleep. You're not surprised by that. Some medications can also disrupt glucose level. Antidepressants can do it. Other medications like Zyprexa, Risperdal, Seroquel, Abilify, Geodone, lithium, they can disrupt your glucose levels as well. Beta-2 stimulators, corticosteroids, dilantin, estrogens, heart and blood pressure medications, oral contraceptives, protease inhibitors, and thyroid hormones. I'm not telling you to change your prescription in any way. I'm not telling you to discontinue your medications in any way, but perhaps talk to your doctor or psychiatrist about it if you're having mood and sleep issues, because managing your glucose could be really helpful. Also, and this one could blow your mind, is not brushing and flossing, believe it or not. Because I was even shocked when I read this, because actually individuals along the BPD spectrum often have difficulty with maintaining hygiene routines, which not only include bathing and brushing their hair, but it can also include brushing their teeth and flossing. So if not brushing and flossing can influence your glucose levels, which we know influences your mood and sleep, that impacts those issues that you're contending with BPD. So how does brushing and flossing do that? How do they influence glucose levels? Well, when bacteria builds up on your gums, it can enter your bloodstream and disrupt your glucose levels. Flossing can help clear the bacteria away and stabilize your blood sugar. Shocker. I know. That one was really amazing. Smoking can do it as well as dehydration. Interestingly, and as an aside, bonus part of the video, here you go, but is that a lot of anger can also be due to dehydration. There have been a lot of studies that have shown when individuals are dehydrated, they have a lower tolerance for annoyance and stress. So keep yourself well hydrated. Continue to exercise in that appropriate range. Maintain a healthy diet. Doesn't mean don't, snack periodically and have those yummy chocolates. I love chocolate, periodically, right? But it's about moderation. It's about managing those things. And I hope that you found this video helpful. Please like, share, and subscribe. And I'll see you next time. Thanks. Bye-bye.